Suboxone, a combination medication containing buprenorphine and naloxone, has become a widely recognized treatment option for individuals struggling with opioid addiction. As we delve into the world of substance abuse recovery, it's essential to understand the purpose, benefits, potential side effects, and risks associated with this medication. Opioid addiction is a complex and challenging condition that affects millions of people worldwide. The road to recovery can be arduous, but with the right tools and support, individuals can regain control over their lives. Suboxone has emerged as a valuable resource in this battle, offering a comprehensive approach to managing opioid dependence. In this comprehensive guide, we will explore the various facets of Suboxone, including its common uses, benefits, potential side effects, recommended dosage, and associated risks. By the end of this video, you will have a thorough understanding of this medication and its role in the fight against opioid addiction. Understanding the common purposes of Suboxone. Suboxone is primarily used as a medication-assisted treatment (MAT) for individuals battling opioid addiction. Its unique formulation combines buprenorphine, a partial opioid agonist, and naloxone, an opioid antagonist. This combination works to alleviate withdrawal symptoms and cravings associated with opioid dependence while deterring misuse. One of the primary purposes of Suboxone is to aid in the detoxification process. By gradually reducing the dosage under medical supervision, individuals can safely transition from opioid dependence to a state of sobriety. This approach helps minimize the severe withdrawal symptoms often experienced during abrupt cessation, making the process more manageable and increasing the chances of long-term recovery. Additionally, Suboxone is used as a maintenance therapy for individuals who have successfully completed the detoxification phase. By providing a controlled dose of buprenorphine, Suboxone helps reduce cravings and prevent relapse, allowing individuals to focus on their recovery journey and rebuild their lives. Benefits of using Suboxone. The benefits of Suboxone extend beyond its primary purpose of treating opioid addiction. Here are some of the key advantages associated with this medication. Reduced withdrawal symptoms. Suboxone effectively alleviates the physical and psychological symptoms of opioid withdrawal, such as muscle aches, nausea, anxiety, and insomnia, making the detoxification process more tolerable. Decreased cravings. The buprenorphine component of Suboxone helps reduce cravings for opioids, which can be a significant trigger for relapse. Improved quality of life. By addressing the underlying addiction and minimizing withdrawal symptoms, Suboxone can enhance an individual's overall quality of life, enabling them to focus on personal growth, relationships, and career goals. Increased treatment retention. Studies have shown that individuals receiving Suboxone as part of their treatment plan are more likely to remain engaged in the recovery process, increasing their chances of long-term success. Reduced risk of overdose. Suboxone has a ceiling effect, meaning that its effects plateau at higher doses, reducing the risk of respiratory depression and overdose associated with full opioid agonists. Potential side effects of Suboxone. Like any medication, Suboxone can cause side effects, and it's essential to be aware of them. While the benefits often outweigh the risks, it's crucial to discuss any concerns with a healthcare professional. Some potential side effects of Suboxone include headaches, nausea and vomiting, sweating, constipation, insomnia, dizziness, respiratory depression, in cases of misuse or overdose. It's important to note that the severity and frequency of side effects can vary from individual to individual, and some may experience little to no adverse effects. Recommended dosage of Suboxone. The recommended dosage of Suboxone is determined by a healthcare professional based on several factors, including the severity of the addiction, the individual's medical history, and their response to the medication. It's crucial to follow the prescribed dosage instructions carefully to ensure safe and effective treatment. During the induction phase, when an individual transitions from opioid dependence to Suboxone, the initial dosage is typically lowered to minimize the risk of precipitated withdrawal. Once stabilized, the dosage may be gradually adjusted to find the optimal level that effectively manages cravings and withdrawal symptoms. It's important to note that Suboxone should never be abruptly discontinued, as this can lead to severe withdrawal symptoms. Any dosage adjustments or discontinuation should be done under the guidance of a healthcare professional to ensure a safe and gradual tapering process. Risks associated with Suboxone use. While Suboxone is generally considered a safer alternative to full opioid agonists, there are still risks associated with its use. These risks include respiratory depression. While the risk is lower compared to full opioid agonists, respiratory depression can still occur, particularly in cases of misuse or overdose. Dependence and withdrawal. Prolonged use of Suboxone can lead to physical dependence, and abrupt discontinuation can result in withdrawal symptoms. Interaction with other medications. Suboxone can interact with certain medications, potentially increasing or decreasing their effectiveness or causing adverse reactions. Risk of misuse or diversion. While the naloxone component in Suboxone is intended to deter misuse, there is still a potential risk of misuse or diversion for non-medical purposes. It's crucial to follow the prescribed treatment plan and consult with a healthcare professional regarding any concerns or potential risks associated with Suboxone use. Suboxone versus other opioid addiction treatments. While Suboxone is a widely recognized treatment option for opioid addiction, it's not the only available approach. Other treatments include methadone maintenance. Methadone is a long-acting opioid agonist used in the treatment of opioid addiction. It helps reduce cravings and withdrawal symptoms but carries a higher risk of respiratory depression and overdose compared to Suboxone. Naltrexone. Naltrexone is an opioid antagonist that blocks the effects of opioids, reducing cravings and preventing relapse. It does not produce physical dependence but requires complete detoxification before initiation. Behavioral therapies. Various forms of counseling and behavioral therapies, such as cognitive behavioral therapy, CBT, and contingency management, can be effective in addressing the psychological and behavioral aspects of addiction. The choice of treatment often depends on individual circumstances, such as the severity of addiction, personal preferences, and the availability of resources. A comprehensive approach that combines medication-assisted treatment with behavioral therapies and support services is often recommended for optimal outcomes. How to use Suboxone safely and effectively. To ensure the safe and effective use of Suboxone, it's crucial to follow a few key guidelines. Follow prescribing instructions. Adhere to the prescribed dosage and administration instructions provided by your healthcare professional. Never adjust or discontinue Suboxone without medical supervision. Attend counseling and support groups. Suboxone is most effective when combined with behavioral therapies and support groups that address the psychological and social aspects of addiction. Avoid misuse or diversion. Suboxone should only be taken as prescribed and should never be shared or sold to others. Misuse or diversion can lead to serious consequences. Report side effects. If you experience any concerning side effects, promptly report them to your healthcare provider for appropriate management. Engage in a healthy lifestyle. Incorporating healthy habits, such as regular exercise, a balanced diet, and stress management techniques, can support your overall well-being and recovery journey. Remember, Suboxone is a tool in the recovery process, but true healing requires a holistic approach that addresses the physical, psychological, and social aspects of addiction. Frequently asked questions about Suboxone. How long does it take for Suboxone to work? The time it takes for Suboxone to take effect can vary from individual to individual. Generally, the medication begins to alleviate withdrawal symptoms and cravings within 30 minutes to an hour after administration. However, it may take several days to reach a stable and optimal level in the body. Can Suboxone be prescribed by any doctor? No. Suboxone can only be prescribed by healthcare providers who have received specialized training and obtained a waiver from the Drug Enforcement Administration (DEA) to prescribe buprenorphine-based medications for opioid addiction treatment. Is Suboxone addictive? While Suboxone has a lower potential for abuse compared to full opioid agonists, it can still lead to physical dependence with prolonged use. However, when taken as prescribed under medical supervision, the risk of addiction is significantly reduced. How long should I take Suboxone? The duration of Suboxone treatment varies from individual to individual and depends on factors such as the severity of addiction, response to treatment, and personal goals. Some individuals may require long-term maintenance therapy. while others may gradually taper off Suboxone after achieving stability in their recovery. Can Suboxone be used during pregnancy? Suboxone is generally considered safer than continued opioid use during pregnancy. However, it should only be taken under the close supervision of a healthcare professional who can monitor the mother and fetus closely. Discussing the risks and benefits with a healthcare provider is essential. Conclusion: is Suboxone the right treatment for you? Suboxone has proven to be a valuable tool in the fight against opioid addiction, offering a comprehensive approach to managing withdrawal symptoms, cravings, and relapse prevention. However, it's important to remember that Suboxone is not a one-size-fits-all solution, and its effectiveness depends on various factors, including individual circumstances, proper dosage, and adherence to the prescribed treatment plan. If you or a loved one is struggling with opioid addiction, it's crucial to seek professional medical advice to determine if Suboxone is the right treatment option for you. A healthcare provider with expertise in addiction medicine can assess your unique situation, discuss the potential benefits and risks, and develop a personalized treatment plan that addresses your specific needs. Remember, recovery from addiction is a journey, and Suboxone can be a powerful ally in that journey. But it should be accompanied by a comprehensive approach that includes counseling, support groups, and lifestyle changes. With the right combination of medication, therapy, and support, individuals can regain control over their lives and embark on a path toward lasting recovery. If you or someone you know is struggling with opioid addiction, don't hesitate to reach out for help. Our team of compassionate and experienced professionals is dedicated to providing personalized treatment plans tailored to your unique needs. Visit our website or call our confidential hotline to schedule a consultation and take the first step towards a healthier, more fulfilling life.